Okay, commissioners, um, this the meeting has started on Pitt TV, so you can go ahead and begin.
Okay, thank you. Good afternoon. I'd like to call this meeting of the Pitt County Department of Social Services to order. This is July 13th, 2021, and we will open our meeting by observing a moment of silent prayer for silent meditation. Okay, thank you. I'd like to welcome everybody in the audience today. Susan, do we have anybody signed up for public comment?
No, sir.
So what we need to do is go ahead and revise today's agenda. Any revisions to our agenda? And if not, could I have a motion to approve? And a second?
Second.
All those in favor? Aye. Okay, and I guess we don't need to, since we're live, Susan, we don't need to call the roll. Okay, and the same with the minutes. You should have received a copy of your minutes. And we'll need a motion to approve if there's no revisions.
Move to approve.
And could I have a second?
Second.
Thank you, Jerome. All those in favor say aye.
Aye.
Aye. Okay, so moving along on our agenda today, we have next item on our agenda is the swearing in of new board member. Actually, not a new board member. Catherine Nelson is beginning her second term as a board member. So Susan's going to go ahead and swear her in. And Susan, if you could give us some direction. Do you want Catherine to come down there? Okay.
Should I put my mask on? Do I do that? It's your decision.
Your decision. And Catherine is also our current vice chair, and we appreciate what she does here in the board.
Left hand on this Bible, right hand up, and you've got it right there to follow by as I read it. Okay. I, Catherine Nelson,
Do solemnly swear and affirm that I will support and maintain the Constitution of the United States.
I, Catherine Nelson, do
Solemnly swear affirm that I'll be faithful and bear the true allegiance to the state of North Carolina and to the constitutional powers and authorities which are and may be established by the government thereof, and that I will endeavor to support, maintain, and defend the Constitution of said state, not inconsistent with the Constitution of the United States, to the best of my knowledge and ability.
I, Catherine,
Do solemnly swear affirm that I will well and truly execute the duties of my office as a member of the Pitt County Board of Social Services according to the best of my skill and ability, according to law, so help me God.
all right, you're now official again.
Thank you. Do I take this one or?
No, ma'am, that's
So
mine.
do we applaud? Do we do? Very good. Thank you very much. Wait till she gets back around over here. Okay, next on our agenda here, this is the month that we elect a new board chair and a vice chair. And just to kind of review, obviously I'm the current chair, and Catherine has been the vice chair. And I guess I will just open it up for motions, recommendations, nominations. Thank you.
Mr. Chairman, would you like nominations for one at a time, or?
Let's do the chair first. Thank you.
Okay. Well, I would like to nominate Jim Cox for chairman of the board.
Okay. And I guess we would ask for a second on that.
Second.
Are there any other nominations? If not, I guess we'll move forward with that motion. And all those in favor that, I guess that I would continue for one more year, the final year of my board term as the chair. I guess everybody in favor of that say aye?
Aye.
Okay, I guess motion passed.
Congratulations.
Thank you. one more year. So, following suit, we're going to do the same with vice chair. I'd like to open that up to nominations too. Catherine is currently our vice chair. As chair, am I allowed to make a nomination? Can I?
Probably better to let one of the
Right.
other board members.
Okay.
I would like to nominate Catherine Nelson as vice chair.
Second.
Okay. Are there any other nominations? Okay. If not, we have a nomination and a second. All those in favor that Catherine would continue as our current and future vice chair, say aye.
Aye.
Aye. Okay, motion carries. So, another year, Catherine. Thank you. Actually, another 3 years for you. So, okay, with that out of the way, let's move on here. So, recognition of new hires and 20-year service anniversary. So, you wanna do that?
Sure. And I actually want to start with the 20-year anniversary. Angela, you want to come on down? Angela? I can't see all the people out here. Angela's not here yet. Well, we'll start another way. Maybe Angela will come in a little bit, because the post is in my way, so I can't see people. Okay, so let's start then with our new hires. We have a lot of new hires in our audience today, and we're really, really excited to have them. So I'm going to start with Duriel Smith. Come to the podium there and tell them who you are, a little bit about yourself, and
And before you start, this is for everybody. This is supposed to be very low stress. Okay, no pressure. This is just a way. This is just a way of you introducing yourself to the board, and we really just want to thank you for joining the team here, and just want to hear a little bit about it. Hopefully, you'll join us again in the future.
Yes, sir. Good evening, everyone. My name is Duriel Smith. I'm officially a month in now. I thought I got hired for Child Protection Services, but it was actually Animal Protection Services.
we've been giving him
Protecting all cats. No, seriously.
Well, either's good.
No, I'm an Air Force veteran. I proudly served in the U.S. Air Force until I was injured. After I retired from the Air Force, I went through a program called Troops to Teachers and became a school teacher. Taught high school, special education. And I was doing it, and I was like, you know what I'm saying, I just want to do something different to actually create change. And I was looking, and I was like, you know what, Child Protection Services is where it is. So I tried. You guys gave me the opportunity, and thank you again for the opportunity. And I look forward to years and years of great service.
Well,
Welcome.
Thank you.
Thank you. Shonda Sproul. Okay. He broke the ice, so now you know what to do, right?
Hi, my name is Rashonda Sproul. I am Adult Protective Services. Background, I did a couple of years of everything: mental health, special education, parole and probation. Facilitated cognitive behavior interventions for offenders. So I look forward to many, many years of serving Pitt County. Thank you.
And we've got Miranda Jenkins with Child Support. Okay. Didn't make it across the river. Okay. June, and one more. LaTanya Hines from Child Support. There you go. There's somebody. You did make it across the river. And today is your
Second day.
Right.
Second day, y'all. I come from Lenore County Social Service, so I'm welcome to be here at Pitt County Social Service. I've been there for 5 years, and I'm Child Support Secretary, Office Administrative Assistant. In my background, I've always been working with the government. I had my own child care back in Raleigh. My grandma got sick, so I moved down here. So I've been here ever since. So welcome. Thank y'all.
Thank you.
Glad to have you. Yep. So I know Child Support's thrilled to have her on the front desk greeting folks. June Mans Everett in Adult Services. There you are.
Good afternoon, everyone. I'm June Mans Everett, And I actually come with over 20 years of experience. I currently work in adult services doing the CAP-DA program, and I actually came from Warren County. I have actually spent the majority of my time in adult services, and I'm happy to be here to continue that.
Well, welcome.
Thank
Excited
you.
to have you. Okay. Paige Caton, come on down. Paige is our newest employee in our fiscal division.
Yes, well, I'm Paige. I'm in accounting. I'll be processing timesheets and all that. My background's pretty much in administration, but I am very excited for the opportunity and very happy to be here.
Welcome.
She's just done her first timesheet experience. This first week was all hands on deck for timesheets.
It's a very important position.
That's right. And Gwendolyn Brown. Gwendolyn, are you out there? There you are, behind the post again. Gwendolyn is in Child Protective Services, so.
I'm Gwendolyn Brown. I come from a background of substance abuse counseling. Happy to be here. It's a little change, but probably about the same. So I'm just happy to be here.
Welcome.
Welcome.
Thank you.
Okay, so that's our activity for today as far as our new hires, and I'm sorry Angela Harrell did not make it here. She has 20 years in child support, and so we will get this to her at her unit meeting. So sorry she didn't make it over today.
Again, we want to welcome everybody. I guess we started this about a year ago. It just kind of has worked out really well for us, and hopefully we have some time to come back and visit us, in the future too. So again, welcome. So, and I guess you're welcome to stay, or you're welcome to go.
Yeah.
Your choice in terms of your day. So, okay, moving on here. Items for decision, and we're going to hear from Brian in terms of the energy outreach plan.
Good afternoon. It's good to be here with everybody in person again. In your board packet is the Energy Programs Outreach Plan, which we have submitted for your approval for the fiscal year 2021-2022. This is an annual plan that we submit to the Department of Health and Human Services, and it encompasses the promotion and operation of the two energy programs, the Low-Income Energy Assistance Program, which is a heating assistance program which operates from December through March, and also the Crisis Intervention Program, which operates year-round, July through June of each fiscal year. The Crisis Intervention Program is also, it is an emergency assistance program which assists families who are having their utilities disconnected. So it assists with either cooling or heating. It's geared toward heating or cooling expenses. The ways that clients may apply for either of these programs, they may apply in person. They may come to the agency and actually fill out an application if they wish to do that, and they can leave their application and they'll be contacted. They may apply, beginning in January, the state opened up a portal so they can apply electronically through epassnc.gov. That's the portal that other public assistance programs may be accessed, food and nutrition services, the Medicaid programs. So the energy programs can be accessed electronically that way. They may also have an application mailed if they'd rather have an application mailed to them, or they can make an application by phone. When we operate the Low-Income Energy Assistance Program, when we confirm with community partners closer to the time of the beginning of the Low-Income Energy Assistance Program, applications can be made on site locally at those advertised locations, as well as at the Human Services Center during the hours of 8 a.m. to 5 p.m. So I really wanted to point out the electronic way of applying. Many clients have accessed this, And it's a great way of people who are used to using the internet to go online and make the application and can do everything from home. But there are other opportunities for those who do not wish to apply that way, and we can accommodate those. I'll be happy to answer any other questions you have about the plan or the programs.
Brian, any questions for Brian?
Okay, so we would just need your approval,
Need a motion.
if you're in approval of this, and then we'll submit it to the Department of Health and Human Services.
If there's no questions, could I have a motion?
Thank you.
So moved.
And a second.
Second.
All those in favor say aye.
Aye.
Aye. Okay. Passed. Approved. Okay, next on our agenda is a discussion about the Lynx trip, and you have information in your packet regarding the Lynx trip.
You need to bring the mic down now.
Good afternoon, everybody. I'm Rhonda Dawson. I'm the program manager now of permanency planning. It's a new position and a new position for me still. So what I want to talk to y'all about is social worker Shantae Carson. She's our links coordinator. She is requesting take 2 of our 18 to 21 children to the 33rd Annual National Independent Living Conference in Orlando, Florida, from August 31st to September 3rd of this year. This conference is being offered through Daniel's National Independent Living Conference. And this conference is geared for professionals and youth and adults who are 15 and up. It would provide the youth opportunities to learn about different programs and to also interact with folks who have been in foster care, who have aged out of foster care, and different programs of that nature. It will also provide Ms. Carson with the opportunity to get additional training because the trainings and the groups are geared towards youth and adults. And some of these classes are youth only, and some of these will allow for adults and youth to be in those classes together. Each child, youth, I can't call them a child there because the ones we're looking at are over 18, will have the money that would be offered to them as a stipend that they would have to budget for the week while they are there. They would each have their own room, one because she's looking at a male and a female, and two due to COVID protocols, to allow them the opportunity not to have to wear a mask because the conference will require them to wear masks the entire time and have temperature checks and different things of that nature. They will have an opportunity to go to an amusement park while they're down there. I mean, you're in Orlando, you gotta go do something fun.
At least one.
Right, at least one. And it will also give these two kids the opportunity to also come back and share information with our current kids that are participating in the Links program. And those kids that get to participate are 13 and up in our program. So I think it would be a really great experience for the two kids she's looking forward going. And their fees and their plane tickets, food, and everything would be out of the Links special funds, which is 100% reimbursable back to the county. And then Shantae would be the only staff member going, and hers would be out of Links regular fund. So the majority of the cost would be 100% reimbursable back to the county.
And this requires the board to approve it based on a request by the commissioner some years ago, since it is out-of-state travel, and the type of out-of-state travel that it is. And if anybody wants to see the packet with all the different workshops, I'll be happy to pass that around if anybody's interested. The total cost, as you see, is $5,077.78. So,
And this is an annual.
this is an annual event. Of course, they did not have it last year because of COVID.
I remember this coming to the board in the past for approval. Any questions for Rhonda?
So this doesn't, oh, excuse me, go ahead.
Is there a contingency plan in case the conference is canceled? Will it automatically move to electronic format?
I actually went on to Daniel's National Independent Living website today just to do some additional reading, and I did not see any contingency plan. What I did find was the contingency plan if somebody, because when they enter, they can only enter through 2 checkpoints, and they have to have temperature checks, and they get a wristband. And if at any point somebody has a high temperature or they get sick, then they're automatically removed from the conference, and they'll connect them with another facility to basically quarantine. But that's really the biggest contingency that they talked about that I was able to find, was what to do and how they were going to be monitoring the participants of the conference.
Okay, thank you. So the children that are, when they attend the amusement park, where is that in this spreadsheet?
It's in, let me go back.
I guess it's under leisure fees?
It's under, I would think, it's under the group activities. The cost per child allows for $200 per
Yes.
child.
Okay. Thank you.
And since there's 38 workshops, that's probably hard to do in a virtual environment. So I suspect if something got so bad, they would probably just cancel
Right.
it and refund money.
And it looked, from what I also read, they're gonna be making the workshops smaller to try and maintain guidelines and things like that. So I think that's another reason they have such a variety and so many different workshops, to keep groups and numbers down in rooms.
Okay, any other questions?
No.
If not, could I have a motion?
Motion to approve.
And could I have a second?
Second.
And all those in favor?
Aye.
Thank you, Rhonda.
Thank
And it
you.
would be nice, maybe next board meeting or the one after, to have a little bit of a follow-up in terms of how the conference went and just kind of, yeah, I think that
Would you
be-
want the youth to come or just
You know,
the
I'll leave-
social worker?
I'll leave that up to you in
Okay.
terms of things, but I would think it would be nice for the board to hear just, kind of, just how the experience went, okay?
Sounds good. I will
Thank
get
you.
with Ms. Carson about that.
Okay.
Thank y'all.
Thank you.
Okay, now, items for discussion, and we're gonna hear from Cynthia, Adult Services. Hey, Cynthia. And you have a handout in your packet.
So what I wanted to come and talk with you guys about this, last month was Elder Abuse Awareness Month, so we usually try and have some sort of information on where we stand. That's our checkpoint with the board. And so we kind of wanted to come and we also have a lot of new members to the board, and so some information may be repetitive and some information may be new to you about our services. The main division, the way we kind of explain our services is we have a set of services that has to do with crisis. That's our adult protective services, our guardianship, and adult home specialist is in there too, because they monitor our adult care homes as well as do the investigations when there's issues or concerns about the operations in those facilities. The second set of our services is our more ongoing, long-term type services that are designed around supporting individuals in the home. The programs that are involved with that are SA in-home, Community Alternatives Program, most people are aware of it being called CAP. We have our in-home aid program, respite, and payee. So those are services for all individuals that are living out in the community. They might be individuals who are completely independent with their daily skills and need a payee or need other types of case management support, to individuals who are needing additional support to be able to stay home and avoid an adult care home or long-term care placement in a facility. So some of them are Medicaid cost-saving programs. Some of them are funds that come from the Area on Aging for individuals who are non-Medicaid. So it's kind of a combination of services to meet those needs with that population. So, growth. Where is business booming? With adult services, it's always one of our pressure points is our Adult Protective Services program. And so I put together some numbers for you so you can see kind of looked at things over some time without looking at every year. So this, what you're looking at looks at the number of reports we received, how many of those are screened in, how many are screened out. So the starting point in year 16-17 is actually 436, and we finished this last fiscal year at 728. So that's really just a 6-year time span to show, I calculated the growth, if my math skills are still retained, at 67%. So 67% growth in just 6 years, and it continues. I did a point check too with Child Protective Services, because we always think of them as so huge, just to compare, because we were always such small potatoes as far as where we were. Child Protective Services reports the number I got from them for their fiscal year is 1,702, so 1,702, and we're at 728. So we're creeping up at their back door, and what we do, and our size is much, much smaller for what we do. So I just thought that was an interesting comparison. Guardianship is our next area that causes a lot of difficulty with growth. So this is our individual served. So we do a lot around guardianship that might have to be establishing, going to court and getting a guardian. Sometimes that's family members appointed. Sometimes it's public attorneys when there's a state involved. But this number only represents the numbers that we currently served. So in that fiscal year, that first number is 125. This last fiscal year ended with 181. And that was a 45% growth. There's always a correlation. The more Adult Protective Services reports we get, the more that we're going to end up into guardianship. So those are individuals who couldn't take care of themselves, didn't have somebody that could step in, and unfortunately sometimes we are the only ones that are able to serve for those individuals. So there's always going to be a correlation where you see one grow, the other is going to result in growth. So the consequences, kind of what does this growth cause, or how does it impact us? I couldn't think of another word necessarily other than consequences, but the impact, how are we affected by it? Our caseloads get really high. Our caseloads are always have been. I've been here 28 years. I've been in adult services since 1996 alone. It's always been the factor that caseloads are higher than standards. It's kind of the norm. We don't know how to function. I don't know what it would look like if we really functioned at that number. But we've learned to adapt. We've learned to do the best that we can. But when we see large growth, it impacts our ability to do things. It results in staff turnover, and it results across the division. So we have our individuals who love social work, love our population, but Adult Protective Services and guardianship's not what they're really interested in doing. They have our support services. They are out there, they're working with individuals in the home, and they're very passionate about it. Unfortunately, when we have that overload, they get pulled into those other programs. So they have to do those other activities, and sometimes that becomes difficult, and it does cause us to have some staff turnover because it's just not an area that they really want to choose to work in. And that definitely happened in our last year, probably our last 2 years. It impacts individuals maybe choosing to leave. We have diminished case outcomes. We can't do things as fast as we want to, as quick as we want to. We just can't always have the best case outcome with the quality that we'd like to see. We always are having to find new resources to train new staff. Not everybody comes to us with a social work background. Not everybody comes to us having worked in a DSS. Pitt, I think, is fortunate that we do get draws from other counties. We do get people who come to us and stay and are very happy to be here, but we're always needing to find resources to train new staff. Feels like sometimes we're always starting over. It makes it difficult when we have this growth to achieve our goals. We've talked a lot at different times in the board about benchmarks, and you get those numbers from us. In Pitt, in adult services, our benchmarks that we have are making sure that we complete our evaluations and make case decisions within 30 days for some reports and 45 for other types of reports, and we've really struggled being able to do that. From the year of COVID, there was a time where we had maybe 3 people in the building to do adult protective services when we're supposed to have 7. So I was out doing a lot of cases, and so was my supervisory staff, as well as our other programs were, pitching in. So it makes it hard to do things and do them on time. And of course, supervisors are out, doing social work. So that was a big impact in the last year. It also, when we have growth, the more individuals that we have that we come in contact with, our waiting lists get higher and higher because individuals are needing services, and we always don't get services and funding for services increased. So our wait lists grow. But with growth, I always like to look at the positives. When you have big growth, you got to find a way to solve it. So one of the things that the message I like to take away about our growth is that word's getting out. I feel like it's a pat on the back. When you go and somebody from the community reports something to Adult Protective Services and they feel like that we worked in that household and we made a change for that person, they're more likely to call us again. So that's a positive. That's a sign of growth, is that people feel like we are doing things and we're making a difference. Whether it be individuals in the community, other professionals, we're impacting a lot of lives. So out of that 728 individuals that we received reports on, 611, I think. I didn't write down the number we screened in. That's the individuals, and sometimes just the fact that we knock on the door is an intervention. It might be an intervention that family makes changes and says, we got to get together, we got to pull together. Sometimes we don't always have a substantiated case, but just the fact that we knocked on the door can impact lives. It can bring people that make a change, that they want to work out something different, or family comes together. So we're always out there impacting lives. Jobs. There's social workers graduating every day, and we've got jobs and are ready to receive them as we get positions. So it forces us to look at our practices. What do we do? Our processes. How are we going to change to meet the demand? I can't always do things in the same way and keep up with the demand and the number of reports. So we have to constantly evolve our processes, make sure that we're not in the way of the outcomes, make sure that we're not causing the burdens and slowing down the process. Statewide, it's been an opportunity for policy change. The growth is not just in Pitt County, it's across North Carolina. People are looking at aging and where that's going, and it's getting a lot of attention. So there's a lot of policy changes coming around adult services that hasn't always been that in my tenure. So it's not just what we're doing here in Pitt County, but statewide there are some changes. Pitt County, what did we do? How did we respond? How did we step up to kind of compensate and work through some of this growth? Traverse implementation. Y'all heard a lot about Traverse, and y'all supported that. The board unanimously supported that technology that we needed. It was much appreciated because that technology and those enhancements, just in small ways, save time for workers. It's a big change for workers so that they can do things when they're out in the field. It cuts down on their time. But from a supervisor and a manager perspective, workers are not always right there where I need them when I get called and I need to make a decision on a case, or I need to understand where we are on something. And it's right there in real time. I can pull it up and I can look at it. So it improves our effectiveness as decisions. And that went into place July of last year. Didn't have any idea that when we decided to sign on to that, we were going to be in the middle of that pandemic. But we made it work in adult services. And from July 1 of last year, we were in Traverse ready, no looking back, and it's been a beautiful thing for us. One of the kind of sad things for us that happened last year is we lost one of our supervisors who'd been with us for 9 years. She decided to leave and go to work somewhere else, but she took a lot of time to make sure that our management and our leadership understood why. That it wasn't the work, it wasn't the passion, it wasn't the burnout, it was the level of difficulty of what was being asked. And it was too much for too many late nights, too many hours, time and time again. And out of that, the board, our director supported, our board supported, our county manager supported an additional supervisor position for adult services. I can't begin to tell you what the difference it's made for us and where we are. I'm going to share a few of those things, but it's greatly appreciated. So out of that sadness, I was very sad to lose her. 9 years of experience and just in adult protective services. She got hired as a worker and moved on to supervisor when I promoted, and she was an asset. But it's almost like leaving a legacy. So that was, just how Pitt County responded to help us out for that. We reorganized. Anytime, like I said, I like to look at what's not working and what we need to change, and we reorganized. We reorganized into some intervention teams, blended units. We were working with a whole unit of just APS, a whole unit of guardianship, a whole unit. And what was happening is those crisis-based services was too many staff for one supervisor to handle. So they couldn't keep up with all of the cases coming in and responding timely. So we split it out, and now we have blended units where there's only 3 adult protective services workers and 2 or 3 guardianship workers. I'm going to kind of show you that breakdown, but it made it so that somebody's not totally in that crisis-based world every day, all the staff needing attention, and you just can't give it to them. And it also streamlined our services so that if there is a substantiated adult protective services that needs guardianship, our hope is it can stay within that same unit, that same supervisor, and kind of own it a little bit better. So we're hoping for good outcomes. In the budget, we got 1 adult protective services worker, 1 guardianship, and that would support this growth that we talked about. And we also got support staff. We need a lot of help in keeping ourselves organized and making sure, just simple things like helping us make sure our court orders are introverse so we can find them. A lot of clerical things kind of, when we get pressured and rushed, some of those details kind of get lost in our we're out there with people and we're out there working. So that's going to be a big help. We're looking forward to those outcomes. A couple years ago, we started doing just a strategic planning just in adult services. So we have our agency strategic plan and we have adult services strategic plan. So we're regrouping with that. We're meeting again in August to kind of pick up and where we need to go, where we are. We've implemented quarterly programmatic training. So the state gives training, but they give all the details and the facts, but they don't operationalize it. They don't tell somebody how to be a social worker necessarily. They tell you what status reports do, but don't tell you how to fill it out and what all that means. So we're working on kind of that for staff and providing that support. And we're maximizing our revenue sources. CAP had a big change in how they're funded and how we get reimbursed for that, which increased our revenue greatly in adult services. We worked on our day sheets. That's the method in which workers document their time and code it to certain things to draw down money. So we worked a lot around making sure that we are utilizing that in the best way we can for our revenue. And we developed some improved tracking of some data. So we make sure that we can come to you and explain where we are. We still have some challenges that we're working on. One of the new things that the state is doing is what they call CQI. That's continuous quality improvement. So that's been going on for many, many years in child welfare, and there's been a lot of different things that have come out with that and implementations, but it's just now reaching us, probably way overdue, to try and improve our quality of service, improve statewide, and make sure that we are serving individuals in the best way, make sure that we're following policy, but it's a little bit more. We've always been audited. We've always had people come and look at records and grade you, and you pass or you don't pass. But this goes a whole lot deeper about outcomes. It's looking at, is our workforce trained? It's looking at a lot of different areas. So that's a new process for us. It's a new process for eyes to look at us a different way, but we're looking forward to kind of that opportunity for looking where we need to grow. We've got some challenges in housing. That's probably no mystery to you guys, that we can't, even if I had money, I can't find apartments for people to live in. So we've got people we're supposed to be transitioning to the community with settlement that's supposed to be in place. So we're supposed to be transitioning our individuals with severe and persistent mental illness out into the community, and we're working really hard to do that, but we are really struggling with finding places that people can live. We've got a predominantly new workforce. You saw 2 in my division today. We've got 3, I think, vacant positions. So out of our workforce, some of our supervisors, all of them that were promoted from workers, and that always increases new vacancies. But we have a very, very new, young workforce in adult services now. They're excited, and that's a great thing. So that is probably rejuvenating for me to be around. People are excited, they want to come to work, and they're so eager to help. So it's exciting, but it's challenging to kind of train. We're needing to expand our community partners, again, when you're constantly rethinking how to do things, and we can't do it alone. So we need to get more people involved out in the community. And developing a workforce with mental health expertise. That's a challenge. Those of you who've been around and know when our public mental health system went down, social services had to pick up a lot of that role. So our social work staff, particularly our adult protective services and guardianship, are the first responders. We're getting called when somebody's out there, somebody's presented to the hospital for an IVC and it's overturned and now they're homeless and, So we need people who are interested and want to work with the mental health population and that have the expertise to work with them, to advocate, to get the resources, to work on goals. We're being asked in our guardianship to make great progress with individuals who have intellectual disabilities and have mental health diagnosis. We're supposed to work on getting them restored and make great strides with them. So I need individuals that have mental health expertise that can work through that and work in setting goals with that group. So I'll let y'all meet a little bit of the team. Y'all know me, I've been here multiple times. Our first in our new reorganization, our first is Nikki Parks. She had to leave in an emergency today. So she's intervention team 1. Nikki Parks, she's been here 7 years. I hired her as an APS worker, and then she was promoted to our in-home supervisor and then promoted to the supervisor of now in our blended unit with 3 APS workers and 2 guardianship workers. Our second one, Priscilla.
Hey, Priscilla. Welcome.
So Priscilla, she started as a worker in in-home services, became supervisor in in-home services, and now she was our first new supervisor hired in this position. And so for the blended unit, she's team 2 with 3 APS workers, 2 guardianship social workers. So she's been around those programs since she's been here, but now she's supervising them. Priscilla has been here 4 years, 3 years, and she came to us from Dare County with 5 years of experience in Dare County. Janet Van Honk. Got to give hats off. I'll clap for her and I'll clap for my next supervisor. They were APS workers that worked with us during the pandemic that
Stuck it out.
and they didn't bat an eye. They went out there every time they were handed a report and did what they needed to do. So, I appreciate them. So Janet will have 2 APS social workers, 2 guardianship workers, and she'll have the adult home specialist. So big hats off and thank you for their dedication. So she's one of our new supervisors in this restructure as well. And our other adult protective services worker, LaToya Heath, is our last social work services supervisor, and she's supervising our in-home unit. So it's kind of new to her. Their expertise is in adult protective services, but they're, as always, giving it whatever they need to do. So we're excited for this team. That's my supervisory team, and that's kind of them and the rest of the crowd. So that's our elder abuse awareness shirts that we got. There's probably a few missing out of that, but that's our group of expertise out in the field. And then if anybody is listening and they would like more information, that's our main number, and calls and inquiries go through adult services intake.
Thank you. Questions for Cynthia?
It's an excellent presentation.
Absolutely.
As I'm getting ready to turn over a big birthday on Thursday, I start thinking about this kind of stuff more and more. But, it did remind me when you were showing the statistics at the beginning about the baby boomers and what's happening with our group and how that is going to impact a lot of the services, social services, health services, mental health. It's impacting it now. And so how we can, anything we can do to help support you in that and thinking, more forward thinking. I like the way that you restructured your teams. I think that's gonna be real important moving forward. But it did, when you were showing how the data had gone up, I was thinking, okay, so this group of us that are aging and getting older and needing services and may not have what they need at home or with their families, thank God we have y'all. So thank you.
And Cynthia, I appreciate your continued passion and compassion for your work. You've been here a long time, and you've been through a lot of changes, and you just seem to kind of reinvent, reorganize, and you keep that passion going, and that's very rare, I think, after so many years of being in a position. And you've been here how long?
28.
28 years. Okay. Which speaks to my longevity because I knew you before you came here, so.
My much younger, naive days. But thank you. Our success is in part, a large amount of our success is the support of the director, and then she brings forward to the board, and the board brings it, once that gets approved. The growth that we've had, the response, it's amazing, and it keeps the staff energized as well to feel like, there's always like, is there a light at the end of the tunnel? But when they have support and it keeps them going, and it keeps their energy up. What can I do? So we're excited.
Thank you, Susan.
Thank you.
Okay, moving along here. Next, we're going to hear from Dr. Augustine Frazier, our Deputy Director's report.
Good afternoon.
Good afternoon.
I sent you guys a one-pager report, and I will speak briefly to those and then ask questions at the end of my presentation. Medicaid transformation. We have been live for the last 2 days, our second week of live operations. Very good, no glitches yet. We have the DHS is supporting us very closely with local DSS officers. Now we have the ombudsman, who is also another layer of support system to consumers, in line with the brokers. So which means every problem that is coming has somebody who can answer those and resolve it before the client becomes frustrated. And clients can change their PHPs up to September 30, no questions asked, which is good. So if they did a mistake when they were enrolled or auto-enrolled, they can do that change without any questions. Also, DHHS has given us bi-weekly Zoom meetings where DHHSs are there to meet, throw ideas, bring creative solutions that they are getting in their localities. That is also helping the clients to have their issues resolved as quickly as possible. So now to the CDBG. We have two components of the CDBG, the utility component and the rental assistance component. For the utilities, we have 56 participants who have benefited from this program. And out of those 56, we have 9 that were low income. We have 12 that were very low income earners. And we have 35 that were extremely low income earners. So which means, even though HUD set up this criteria, we are now breaking them down to that category so that these can be subjected to further review by the division and by other agencies out there. We have given $26,396 to these 56 participants. 19 applications are pending as of yesterday. I did not check it today to see where we are. The average computation of time it's between 3 and 5 days for us to review one case to make a case decision. The rental assistant, that's the difficult part. We had several discussions with landlords. Nobody wants to forgive any portion of their outstanding balances. And what we are saying is clients have already moved out of these rental properties, therefore they cannot participate in the CDBG grant. But we are trying to work out some logistics, how we can hook up that population and make sure they benefit from this grant as well. The second problem we are also looking at resolving is maybe the landlords will not forgive anything, but zero is a number. So we are also looking at that possibility to bring in more landlords to participate in the program. However, the problem is if the clients are not on the premises, we cannot work with them. So that's our dilemma. At this point, we only have one candidate who is potentially qualified, and we are working very closely to work out the paperwork and make sure she gets her benefits. I can answer any questions if you have any.
Questions for Dr. Frazier?
Not at this time.
So, yeah, who are some of your community partners that you're working with these landlords?
New Hope, the Hope program,
Yes, yeah.
Green Light, Crossroads, and we are also working with Pitt, Biddings Group. We have a weekly session that we meet to make sure we cross ideas, share resources, and make sure we are gathering all of these components together.
We've also connected with legal aid.
Yeah, legal aid.
So we're
Yeah,
working with
thank
them very closely to see, who they have in their pipeline.
Correct.
Yeah, I've been involved in working with Dr. Frazier around this, and also the city of Greenville also has a CDBG grant. So we have come to the table sometimes weekly, and we've had at least 2 landlord forums. We're invited landlords, from an educational standpoint to learn about the different programs that are available. So, yeah, those have been kind of the efforts in terms of this. So there's been a coming together of resources.
Thank you.
Thank you, Dr. Frazier. Okay, moving on to Ms. Elliott's report.
And I'll try and be real brief. You have a copy of the MAD and other Medicaid processing report for the month. As you see, our staff did, as always, a fabulous job. We always like to process at 100%, but you can't always do that. So 97% of our MAD cases were processed timely, and 93% of our other Medicaid. You can see our processing timeframes of 27 days and 63 days, so well within the guidelines, and so staff are doing a fantastic job. You see our vacancy report has gone from that 20 that we normally have up to 31, and that reflects the new positions that were approved in the budget, which, we have been told quickly that we are not allowed to put all of them on the street at the same time because that would swamp the county's HR department, if nothing else, because there are other new positions in the budget besides just ours. So we are slowly working those out, a few a week. So this number will look very high for a while, I suspect, as we work through those new positions. Plus, we're still recruiting for the other vacancies that we have. And you can see that we've got, I think that's not, I can't even read this right this second. We have 19, I believe, that are in some form of advertising. We have 2 awaiting background checks, 3 that we're screening, and 4 that are already in interview. So, and then several that are frozen. But that just, so we've got a lot of positions out there waiting to be. So that's kind of my report. We've got LEAP supplemental update on here. That was just in case there was anything new to add, but nothing really going on there. We've pretty much ended that process. There may be some interesting things going on with energy as well as water, as the federal monies start flowing through. Well, the state's still trying to get all that worked out, so there may be some monies coming up in the near future. I have heard, but I have not received anything in writing, that the board member training may be postponed. So, we'll let you know as soon as, and you may get something yourselves directly since you are all registered, but we have been told verbally that that may be happening. So that's all I've got, unless anybody's got a question about anything.
Jen, can you remind us of the dates of that training again?
Was it August 5th?
6th.
5th and 6th. I was thinking it was August 5th and 6th, right.
So they should be letting us know pretty
They
quick.
should be letting you know pretty quickly. I've reached out today to say, are y'all not gonna put anything in writing? Because all I've heard is just through a meeting, somebody said that, so. So put a question mark there, don't give it up yet, but, I think they're gonna be postponing it.
Okay.
So, okay.
And if they don't, I forget the times for that, is it all day?
No, it's not all day, it's mornings, isn't it, Augustine?
Yes, in the
Yeah,
morning.
Augustine signed up, I did not, so.
I will send those to you. Dr.
Thank
Ban.
you so much, I appreciate it.
Okay, any questions for Jan? Okay, if not, next on our agenda, the board is going to go into a closed session. And it's my understanding, Susan, you have a statement to read, or do we need to?
Do we do motion and then I
You
read?
need a motion to go into closed session
So I
first.
need a motion to go into closed session.
But we do need to know why we're going into closed session before we do the motion.
Okay, I couldn't remember the order there. Okay. North Carolina General
You can stay.
Statute 143-318.11 regarding closed sessions. Section A, permitted purposes. It is the policy of this state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required. Also, item number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state as of the United States are not considered a public record within the meaning of Chapter 132 of the Personal Statutes. This closed session is regarding to personnel, so it is closed to consider the qualifications, competence, hold on. Nope, I think I'm reading too far. It's been a while, but yeah, we're good now.
So that's the purpose. So what we need is a motion to do that. Could I have a motion to the board to move into closed session?
So moved.
And a second?
Second.
And all those in favor say aye.
Aye.